Let's talk about access to outside community care provided by the VA healthcare system. All right, so we got to start all the way back in 2014 when then President Obama signed into law the VA Choice Act. It was a bill that went through Congress and passed and got to the president's desk that was going to allow veterans to get all sorts of access to healthcare that they previously didn't receive. Now, in that program, certain rules were made to allow veterans to have access to community care providers. Specifically, if you had to wait longer than 30 days for an appointment, if your residence was over 40 miles driving distance from that VA medical facility, if you needed to travel by air, boat, or ferry to that VA medical facility, or, and this is something specific that we put in Congress, was if a veteran faced an unusual or excessive burden in traveling to the closest VA medical facility based on a geographical challenge, an environmental factor, a medical condition, or other specific clinical decisions, they were to alert the VA staff so they could receive outside community care. In 2018, President Trump then added on to this bill in calling it the Mission Act, which allowed not only the same access and extended it, but it actually shortened the wait time for specialty care. Then he also signed into that bill a specific clause that allowed for veterans to receive outside urgent care access for veterans that were participating in the VA healthcare system through a network of providers that was available on va.gov. Veterans can still use these two programs, as it has kind of morphed into what they could now call the Veteran Community Care Program. Let's talk about what that means for veterans who are dealing with the VA and they believe they meet that criteria and they want access to that outside community care provider. It's really simple. When you're on the phone with the scheduler and you're making an appointment for VA care, and they say it's over that amount of time, or it's further than that distance, or there's that unusual excessive burden to you, you communicate to that person that, hey, you like to invoke the Mission Act or the Choice Act based on any of those reasons, and that you would like to be seen by an outside community care provider. They should then grab your information, verify it with you, and send it off to somebody from the outside community care providers network, and they'll contact you to schedule an appointment sooner or closer. Lastly, if you're looking for urgent care assistance, go to va.gov and click on this link right here, and you can find urgent care providers closest to you. Now that you have this information, make sure you're using this whenever necessary to ensure you're having access to health care benefits that you have earned while serving in the United States military.